So we're going to have our panel today is going to talk a little bit about health ministries, how to build and evaluate and sustain health ministries, and a little bit about self-care. Now, we recognize when we say health ministries, it's kind of an umbrella term that we use. So we know that many of you are integrating this as a part of an existing ministry, so it may be a care and concern ministry or volunteer visitation ministry. And we just want to let you know that when we're saying health ministry, it is an umbrella term, but we use it to kind of refer to any variety of these types of ministries. We also recognize that each of you are at different stages or different levels of what your ministry is. So some of you may just be starting, or this may be just an introduction. Some of you may have been doing this for 20 years, and you feel really comfortable in what you're doing. And so the goal of the panel today is to kind of have speakers from a few different levels of health ministry. So we have one speaker who actually completed a certificate through the Heal the Sick program, who is just beginning health ministry. And so she's going to talk a little bit about where she is, the challenges she's had, and her needs and what she would like to have from her faith community leaders, her clergy, the things that she's seen. And so if you're in that level, that hopefully you can relate to her and maybe share some concerns or learn a little bit from what she's sharing. We also have someone who has been involved in this type of work for many years, and she's going to speak a little bit about her experiences. And then we're going to have another individual who was helped through a ministry, who was a patient and a congregant. And so she's going to speak a little bit about her experiences with that and hopefully give some ideas, some tips of what went well and maybe what could be improved, and so that as you're working as a liaison, that maybe you can learn from someone who has been a part of this. And then finally, my boss, Tom Pruski, is going to talk a little bit about evaluating, so the importance of evaluating your ministry so that you know what is working well and what could be changed, and so that you can share with your faith community or other individuals why your ministry is important and why the work you're doing is important, because we recognize the importance. So we want to thank each and every one of you, because the work that you're doing is amazing and awesome, and we hope that we want to be able to help you to illustrate that and to show that. We're going to, and then finally, Tom's going to talk a little bit about self-care. Burnout is a big deal, and how many of you have had experience with ministries where instead of saying that's the care and concern ministry, you talk about, okay, that is Sue's ministry, or that is Sam's ministry, and it's one person, it's kind of seen as one person's ministry, or it's kind of a one-man or one-woman show, and we know that that can cause burnout. So we want to talk a little bit about self-care and kind of tips for dealing with that, so that you don't burn yourself out being that person who cares for other people but doesn't take time to care for yourselves, because everyone needs to do that. So we're going to go ahead and get started. We're going to have each of the panelists come up and speak for about 5 minutes. Like I said, we want to get you out of here. Hopefully you're able to learn from this. And we do encourage you, if you have comments or questions, or if something they say resonates with you after the panelists or after everyone's done, if you want this, or you have something that you want to contribute, we encourage you to contribute that, because we want this to be a learning experience where we learn from each other and we're not just speaking at you. So if you're interested in learning more about Heal the Sick or learning more about our programs or have any questions, feel free to come up to me or Tom afterwards. We'd love to talk with you. So I'm going to go ahead and pass the phone to Tanoa, and Tanoa, if you can give a little introduction about who you are, and then we'll go ahead.
Good afternoon, everyone. My name is Tanoa Hampton, and I'm a registered nurse by trade, but I came across the Heal the Sick program when I was researching health ministries. And I found it as an opportunity to join my life work as a nurse with my passion, caring and supporting those in my faith community. So as a result of the Heal the Sick program, the Health Minister Certification Program, I am 4 months into working to establish health ministries. So there's a lot of woes and concerns and a little apprehension, because sometimes there isn't a clear definition of what health ministry is when you present it to the church. So some people call it pastoral counseling, and that's their ministry and that's their area. Others say we're the nursing ministry and we hand out Kleenexes and mints on Sunday morning, and then others do community outreach. And I think it's very important as you enter into the process of establishing a health ministry that you determine what your health ministry will look like. So this partnership that we're here learning about today is a good opportunity for you to begin to think about the services and things that you would provide to your congregants. But with that comes an assessment. You have to assess the needs of your community, because what you believe they may need may not be what they're actually asking for. So one of the things that we learned during the program was assessing your community, not just believing that you knew what was the right thing to do, but actually getting out there, asking the question, is it that I can't get to church because of I'm caring for a loved one at home, so that's why I can't come to church? Or is it that I am unable to pay for my prescriptions because I'm caring for my grandchildren because my daughter is addicted to drugs? So unless you begin to deal with the social determinants of health that impact their ability to reach their optimal health and wellness, you'll never get there. So one of the key things that I learned from the program was really assessing your community and not reinventing the wheel. So over the last 4 months, I've spent time contacting people in the community to find out what services already exist, what other churches are already doing some things that we can partner with or that I can partner with so I can learn what's going on. I've reached out to government officials, people already who have nonprofit organizations, just to find out the services that they provide and how I may be able to partner with them to facilitate providing health resources for the people in our community. And so it's been a delight, but yet at times uneasy process, because you just don't know where to start and you don't want to offend anyone in their ministry, but you want to support them. So be sure that you have a clear definition of what health ministry looks like for you and your congregation and the services that you'll provide. And then don't try to do it alone. Figure out who's in your community, in your church, that has a heart and a desire to do God's will related to health, not someone that's just looking for a position, because though I may be a nurse, in this case, I'm not necessarily using my nursing skills, although I'll never let them go, but my goal is to attach them to their faith, the foundation of what they believe in order to achieve their optimal health and wellness. So it has been a challenge, and I'm still growing through the process. 4 months in, but it has definitely been an experience, and having a network of people that are doing the same thing that you're doing is key to have those conversations, and don't be afraid to ask the question, because you don't know what's going on until in your community until you ask the question, and someone may be able to give you a resource that they found out that works for them that your congregation can use. So that's been my experience as I'm just in the startup of the process of learning what health ministry is and what it looks like in Baltimore City, because it definitely has to meet the needs of the community and not what I perceive the needs to be in my mind.
Thank you, Tanoa. Good luck on your mission. My name is Beth Phillipson, and I am also a registered nurse, and I have been the congregational nurse at Temple Oheb Shalom for the last 10 years, and also had the privilege to serve for 2 years at Beth Israel Congregation in Owings Mills. So I had the opportunity to see what it was like to work in two very different congregations. So what Tanoa said about assessing the needs of your congregation really is important, because I find that each congregation has its own personality. What one congregation needs is not what another congregation needs. And I find in one of the congregations, we had a very active caring committee, and people looked out for each other. And in another congregation, sometimes it's really difficult to get somebody just to drive somebody to a doctor's appointment. So you would have different needs in those two different congregations. My role as a nurse has been both using my nursing skills and using my other skills, if you will, my ministry skills. I'm either there to be there and hold hands and just show support and sometimes not even say anything, and sometimes I'm called to fix it. And I find that I end up putting out a lot of fires. I serve as a patient advocate for my community, and I get calls from the emergency department. Something doesn't seem right, we need you to come. And I'm happy to stop and go. Now, that being said, I also need to talk a little bit about setting limits. The last time I got called to an emergency department was on a Saturday night, and I was having dinner at a friend's house. My husband knows me pretty well, and he knows when I get a call, I'm going. But that doesn't work for everybody. And you need to decide early on what your limits are and how available you want to be to your congregation. If you shut your phone off at 10:30 at night, then you tell your congregants, I shut my phone off at 10:30 at night. If you want to give them your cell phone number and be available 24/7, some of us do that, you'll get calls in Europe. And they don't know what time zone you're in when they call. But that's your choice. And I have chosen to be available for my congregants whenever they need me, and it's been a blessing, and I've been doing it, like I said, for over 10 years. I also have to define my role very carefully because I am a licensed healthcare provider in addition to being a member of a congregation. So sometimes I'll take people to their doctor appointments because they don't have a ride and they're elderly or whatever. But when they get in my car, I make sure that I tell them that it's not Beth the nurse that's driving you to your doctor appointment today, it's Beth, your fellow congregant. I don't have a license to drive an ambulance, okay? So I make it very clear what hat I'm wearing when I do these things. When I go into someone's home to do wound care so that they don't have to go down to Hopkins every single day, I'm working as a nurse. I'm using sterile technique. I'm doing what I was trained to do in nursing school. But when I drive Fran to the doctor's office, I'm being a congregant with a car. And you need to make that distinction. So you need to assess the needs of your congregation, make sure they know what your role is and when you are willing to provide services, and then you need to take care of yourself. And it's really, really hard for me to say no, and I do have to do it sometimes. And you have to learn to be comfortable with not being there 24/7. And I haven't mastered that yet, but I'm better at it, and it takes practice. Okay, did I hit everything? I'm going to introduce my friend and fellow congregant, Bonnie Block.
Good afternoon. It's a privilege to be here with all of you. I am a recipient of Beth's Ministries. Someone here asked me, what do you do? I feel certain this person, besides being friendly, just wanted to know my job in relation to the conference. I'm not immersed in the healthcare profession. Smiling and shaking my head, I continue. You don't want me to be in a place where there's a medical emergency, for I am the original Chicken Little. I could almost feel that he would have liked to follow up with, well, then who are you and why are you here? Well, I am a mom, a granny, a wife, a sister and a friend, a teacher, and a person who strives daily to make a positive difference in this world. Who are you? I was a little 7-year-old girl 66 years ago who lost her 29-year-old dad through circumstances surrounding a gallbladder operation. You know, it's been so long, but it still chokes me up. That's the way it is. Life changed drastically from our happy household to one where elderly grandparents lived, older aunts and uncles visited, all got sick, and they too died. In my mind, I saw illness that might require some form of surgery or worse, a hospital stay, as a death sentence. Who are you? 9 years ago, I received a phone call I had been waiting for. It was to dismiss any thought of my having a cancerous biopsy from my right breast. Mrs. Block, the woman on the phone, said, I'm so sorry. I never did let her finish that message as I dropped the phone and began to scream, impossible, not me. After being held by my husband what seemed like hours, as I continued the crying, I thought, why not me? What makes me better than anybody else? What to do next? Call Beth, my dear angel fellow congregant. You see, years ago I had had a hysterectomy, and with great embarrassment explained my fears to our congregation's angel nurse, Beth Phillipson. I was immediately embraced by her physically and emotionally. She held my hand and my family's as we walked through the necessary steps to take before, during, and after surgery, all the while reassuring us with positive messages. What to do now? Call Beth. Beth did know that I was going for this procedure, as I had turned to her to find a way to somehow reduce my anxiety. Often during this difficult wait time that seemed to last forever, Beth would call sharing supportive feelings. It could have been a phone call just to say hi, or when I would see her at Temple, she gave me the most precious gift of support, a warm, nonverbal hug that says so much and makes you feel so grateful that she's part of your journey. Those kind of gestures truly help to reduce the, oh my God, what am I going to do kind of fear that lingered throughout the day. My dear husband and children were also there with similar endearments, yet I knew they were scared too. Those same actions from Beth, with her medical background and experiences, made the sentiments feel not more loving, just more reassuring. Do you want me to go with you to see Dr. Freeman? She immediately asked. Oh, would you? Oh, I knew that Alan and I would never hear the words the doctor would speak for sure. The only word we were ever going to hear was cancer, cancer, cancer. I'm always finished. With Beth leading our way into Mercy Hospital for our appointment with Dr. Freeman, our journey began. After my examination and reading the records, he shared several procedures. Beth shared all the options again with us in great detail. That conversation helped us make a most important decision. As Alan and I left the doctor's office, Beth went back in. She shared she wanted to say hello again, as he was her neighbor. As we were riding home, we found out that she stayed back only to make certain Dr. Freeman felt we had really made the right choice. Beth gave us still another reassuring gift on this journey. April 5th, 2007 was my surgery. As we entered the check-in area of the hospital, there was Beth waiting for me. I was admitted and led into an area where the heart feels like it's going to jump out of your skin. Time just seemed to stand still. Beth was allowed to stay with me on my cubicle my whole waiting period. My family came back several times. While I was grateful to have them, seeing the fears on their faces, I was so grateful they left. Beth brought a prayer book, and we read several passages together. We then shared our own prayerful thoughts, and we even had a sister of mercy visit our cubicle and share her prayers with us. Time came for Bonnie Block to have a lumpectomy. My fears seemed to disappear from the center of my heart, and a deep feeling of hope, faith, and love began to come and to enter my body. Beth stayed with my family in the waiting room to hear, thank you, God, the positive results. The surgery went great. 3 weeks later, I was to begin this new radiation procedure of having 2 intensive treatments for 5 days. At first, I was so much uncertain about doing this. Is it going to be as effective? I don't want to be the person that's on a test drive. With the doctor's advice and Beth relating her recent findings from literature, I thought, sounds great to me. 5 days and life would be back to normal. As I was being prepared to have the procedure, Dr. Freeman shared there was a problem. I no longer had the necessary measurement for such a procedure. The decision now was to receive 45 radiation treatments. Worried, Beth once again explained that it meant that I was a good, fast healer. Satisfied by her comments, I was ready to begin my cure. There were times during my treatments when I worried that I was tired, a feeling I rarely experience. Talking to Beth, my angel nurse, by phone or seeing her at Temple, she'd hug me first, hear my message, and share thoughts of encouragement. There were times when I needed to step out of my comfort zone. Occasionally, I needed help from others and had to take up their offers. My feelings are always, how can I help you, rather than you to have to worry about me. Beth helped me to overcome the replaying of those old internal messages. When Beth called to see if I would consider presenting today, I immediately responded, sure, what, when? There is really nothing that I would not do for my very special angel buddy. That's a feeling that is present in all the many congregants Beth has helped. Yes, Beth has given each of us unconditional love and support that aided us in feeling empowered to face life's challenges with grace, hope, and faith. Who is Bonnie Block? I'm a lady who lives each day filled with gratitude, who feels so blessed to receive daily miracles. Beth Phillipson is certainly one of my miracle blessings. I pray that everyone has such an angel on their life's journey.
Hi, I'm Tom Pruski. I'm the director of the Heal the Sick program at Wesley Theological Seminary. And I'm going to talk about and contextualize, we have been working for the past 3 years out of the District of Columbia. The seminary, actually, the mission is to equip people for ministry. And one of the big parts is there are resources that are available, education programs. You heard about our certificate program that Tanoa has been part of. So there's a specialty practice in nursing called Faith Community Nursing, which has been around for the last 2 years. It's actually now a specialty practice from the American Nurses Association. And then also I'm on the board of the National Health Ministries Association, which has been around for more than 25 years. So everyone who isn't a licensed registered nurse, we came up with some guidelines and curriculum elements. We use this as the document and footprint for creating our certificate program that Tanoa talked very eloquently about. First of all, I want to thank all of the folks who have talked about their different experiences, Beth, Bonnie, and Tanoa, because you get a snapshot from the faith community. And I also want to thank all of you, because after this meeting, we all know that the work begins with all of us in the faith community and our congregations, because that's where it's going to come out. And we have experience in that. We actually have 2 networks that we have created. Our program, our exact program, is based on the Memphis model. And we saw the early challenges. We actually work with a hospital system in Northern Virginia, where we have a network that we work with them, and also in wards 7 and 8 in Southeast DC. One is a hospital-based model, one's a community-based model. We also did congregational interviews to figure out where are congregations in all this, to figure out how they could figure out where are their congregants coming from. What we found from over 14 different congregational interviews was that congregations have many people that travel great distances. I actually had someone come up to me, a pastor who's here from Towson, and said, we have people travel probably to the hospital system that you're talking about today. So we are a very, a society that moves around very a lot. And we found that from our congregational interviews, we captured some of that. So what I'm going to talk about is the importance of self-evaluation and also self-care, those 2 points. The big part is evaluation's new to a lot of congregations. Many people feel, especially based on those congregational interviews, feel like we're doing this because we're called by our faith. And, you know, the scientific piece of this of trying to measure the outcomes and everything else, one of the things we talked about here is that's important. How are our ministries evolving? This is an evolving ministry that could be part of your faith community and seeing and considering the different options. We cover that in our certificate program. The 2 most sought-after modules that are part of our curriculum, and we have a handout that refers to some of these things, were active listening and theological reflection. I think what Dr. Fossarelli talked about this morning, it highlights that gift of presence, and you heard that in the presentation here. I know people in the faith community, you can echo that and hear that. That's a big part of what we're doing. So the piece is, in your packets, or if it's being handed out, we have a Rating for Your Health Ministry tool that we developed at the seminary. It's a 13-point based tool that actually looks at some different best practices. This is based on national best practices that I work with on a national level. I'm also a board member of the Health Ministries Association, which has been doing this work for more than 25 years. So we bring a lot of this experience too, and we know what faith communities go through in trying to engage in this work. So measuring outcomes in different ways of ministry is new. So this is one tool that could help you in forming a health ministry and looking at maybe what ministries are already existing and how they might fit into this model and partnership in creating this faith community health network. The big part is, how do you do self-care? A lot of, at being a church-based seminary, we serve over 26 different denominations. We've actually had Muslim students go through our health minister certificate program. Over 60 people have taken it since we have doing it, and we're working towards an online module or online offering of this certificate because we recognize the need for faith communities to understand what is part of this, and also from their perspective, the challenges. Liability was talked about. That's one of the modules that we created in the certificate program to help congregations understand what are the implications. So a lot of this comes from that point, and us being a resource, Wesley Theological Seminary, for you. So self-care. And when you engage in this role, you're a natural helper. Well, one of the difficulties of being a natural helper is, and we find this often with clergy, is that how do we care for ourselves? The Sabbath for them is Sunday. That's a working day for them. So when do they find time to actually have their Sabbath? Do they schedule it? When you're engaged in health ministry, when is your time for your self-care? We're at a retreat center. How do you engage in this? And this is an important part as we engage in this Faith Community Health Network is, and I mentioned this to the folks over at Lightbridge, how are we going to care for the people who are caring and being part of these ministries? There are complex questions, anxieties around all this. I heard that, and we hear this a lot. But how are you going to care for yourself in doing this work? I want to make sure there's increased rates of clergy suicide that are happening. I want to make sure people are aware of that. The part of making sure that you care for yourself, as much as exercise, both under and overeating, is also what are you doing to nurture your spirit. That's why this certificate was created, because it's complex issues. There are complex subject matter that is being undertaken, and it's important that we think about that. And so it's a broad landscape, skill-based program that we offer at the seminary. So those are important points of, do you exercise? How is your own spiritual life? Those are questions that we need to be asking ourselves as we engage in this work from the faith community perspective, and that's what we stand for at the seminary. I'm actually Catholic, and I work for United Methodist Seminary, just to give you an idea of the openness that we all need to feel and all the perspectives that actually look at this type of work. And I want to just reemphasize what Dr. Fessarelli said about those challenges in the dichotomy between healing and curing. These are going to come up constantly. And to be well-grounded in those language and concepts is absolutely essential to the work. And again, I want to just emphasize, everyone in this room who's about to take on, this isn't a short-term project. As Bonnie was saying, this is a life journey. And I want to make sure that we emphasize that. I've been doing this work more than 15 years. I consider it my vocation to be where I am right now, and I'm very appreciative and thankful to be part of creating this network. I also want to say thank you to LifeBridge to say yes as a hospital system. I mean, we're all taking a leap of faith in this, and I want you to think about that and say, we're all saying yes to something, and it's going to take commitment, and lots of questions and answer. So I think we're going to move into that now. So I'm sure you have lots of them.
So I guess we just want to give you time now. We had earlier time to ask questions specifically about what the Faith Community Health Network is going to look like and the logistics, but give you time if you have comments or questions or things that you've learned, if you've been involved in this, ways that you've found have helped you avoid burnout or self-care that's worked, or any concerns or challenges that you've faced in leading your health ministry, whatever that's looked like. If you want to share that with anyone else, we would be more than happy we want you to learn from each other just as much as we've learned from you and that you've learned from us. So if you have any tips or suggestions, definitely please share that now, because it's important that we kind of learn from each other, especially folks who are, like Tanoa, who are starting out. There's a lot of room for learning and growth from people who have been doing this for a while. So, or if anything anyone said resonated with you. So if there's anything you want to share, if not, I'll get out of your hair and let you continue eating. So.
If we decide to take on this ministry, Is there some kind of a support group for us, or do they have seminars that, like once a month or once a quarter of the year?
Suzanne's going to answer that question they had.
That is a great question, and the answer is yes. We're hoping to do monthly conference calls where the first half hour will be to check in on successes and frustrations and help each other walk through some of those if it's appropriate. And then the second half of the call will be more subject-based, like on something like active listening or talking with someone who's dealing with end-of-life issues or things like that, and we'll be pulling from resources. There are so many great resources in our community and so many people who want to work with the faith community. So we have people knocking our door down to be a part of that, but we really want it to be led by what your interests are and what the needs of your congregation are. So as we gather on those monthly check-in calls, we'll get an idea of what your interests and needs are and then set up the agendas for each monthly call from there. Thank you.
When we first started talking about this at our church, in our small group, one of the biggest concerns some of the members of that committee had were personal liability issues as far as it concerns individuals who transport people to the hospital or to wherever you might need to take them. So that is a major concern, actually. In the group of probably, I'm going to guess and say 8 people, everybody had the same issue, the same question, so that might be something to be discussed at another time also.
Yeah, one of the things we did for the certificate program, both for the faith community nurse and also for the health minister, we call it health ambassador, could be a liaison role. There's many different terms. We worked with a nurse lawyer from Harvard to develop some of these questions or look into. And what I would recommend that you go back to your church, just pulling from the curriculum from my head, is and look at what liability insurance you have and talk with the person. I can maybe even talk with Susanna. Maybe this might be a webinar subject matter in the future to discuss how to do that. But they can look at some of those different pieces of what's already set up and what are the clear policies and procedures, role descriptions. Beth spoke very eloquently about the separation of the 2 roles. And we actually do role plays in a lot of the different modules, such as the legal liability waiver piece of looking at some of these issues and how it impacts the congregation. And if you want to speak to me afterwards, I'm more than glad to kind of pursue that. But it seems like a common theme or question that is in the room also.
I wanted to make a comment also about self-care. You need to utilize the resources within your congregations, but I am fortunate to be a member of a team that has a social worker. And I very distinctly remember the day one of our congregants was diagnosed with ALS. And I was at Hopkins in the lobby at the outpatient pavilion, and I called my social worker in tears and said, I don't know what to do. And this is how I take care of myself, is when I feel like that, I have people that I can call and get the help that I needed, because I was at a total loss that day. I was just as devastated as the patient was. And I wasn't afraid to admit that I didn't have the tools I needed to get through the rest of that day.
All right, well, I guess we'll wrap it up. If there are any questions for any of the speakers, I'm sure we're more than happy to speak with you afterwards. So, I guess we'll move on to continue eating. No? Oh, sorry, there's a question there.
Yes, the question I have, the person is involved in this health program. I guess my concern is transportation. If the person that's involved in this program needs transportation to get to one of the networking hospitals, would LifeBridge be able to provide that, since I have seen around the cities mobility that picks up some of these patients? Would there be an exception for those that would be involved in this particular pilot program here?
I can't specifically speak to that, so I'm trying to see if there's anyone around who can.
Because if we can, it may not always be where we can actually be there tangibly, but we can make the provision to set up the transportation to pick them up and bring them back from an appointment if they may need that.
Yes, I know Lightbridge Health does have transportation that takes place. One of the things that's a good question you raised, and we'll take that back and consider that. But I also know that people are eligible for mobility and things through MTA. So we would encourage you to try to use those services. But I would take that back to the table and see how we can better partner with our communities.
Okay.
I can mention also from as far as transportation from a faith community side that with legal and liability issues, this is one of the scenarios we do have in our modules for the certificate. And we discussed basically you have to have an active the license list, insurance list, and all those other things. I won't get into the specifics, but that's just an example of looking at a policy and procedure, a role description, so on and so forth. Those are very specific definitive pieces. Another thing with self-care is when you define what this liaison role is in your own faith community, have a time limit to revisit that. We have a lot of experience in terms of how long will this person serve as a liaison in your faith community. One of the things that we find in a lot of congregations is people feel like when they get into ministry, it's a life sentence. In a good way, not in a bad way, you know. So part of that is evaluating where you are in your life because your calling might change, right? So the calling, we have people who have been faith community nurses that have become ministers, clergy. As you journey, we are here with you to kind of be part of that journey. We're here, and that's part of the seminary's work that we recognize as the evolution of ministries, the roles that are. This is part of the evolution of all faiths. And I like the experience that both Bonnie, talked about, and also Beth, because there was a sister of mercy, I don't know if you caught that visited in the hospital. So it's this whole dialogue in the pieces. I think the contextualization that Dr. Fassarelli, it was excellent to talk about the language and concepts. We dive into that even more with the certificate that we're working to put online to help you with these questions. Any other questions at all?
I just had a comment for that question. In Carroll County, you have to remember the liaison and the navigator, they're there to help connect with resources in the community. So if you're the liaison, it doesn't mean that you're going to take care of that person's every need. So as with transportation, that's one of the resources that you have to know about in the community. And it's different, with Carol and Life, we're all Life Bridge, but it's different with Carol, Sinai, and Northwest. So those, that's something that you have to work out. There's resources with the navigator and the liaison.
As a liaison, will we get a list of people that we could? Yes. Okay.
But sometimes we might not even know that there is a something available. Okay.
And we'll be talking about that a little bit more in the last session today.
Okay.
as far as the toolkit and other things that can definitely support your work. Definitely, LifeBridge is a huge resource, but there are some questions that you might get that aren't directly related to hospitalization or even transportation, that resources that you guys may know about, but you guys might not know about, and we'll put it all in one
Right.
central place online and in print for
Okay.
that, to support your work. Yeah.
Great. Yeah, could someone please, I guess a nurse, define the difference between a navigator and a liaison?
I understand. Pam Phillips. The difference between an RN health navigator and a liaison is as follows. The navigator meets you at the hospital and help you navigate through your health care. The liaison is from the congregation that you or your faith leader has identified, and they have agreed to be the liaison or the bridge, this is corny, or the life bridge between you and your faith community.
So, in a nutshell, the navigator is when the person's in the hospital, the liaison is when they're out of the hospital. Is that what you're saying?
No, ma'am, I'm not. Okay.
Is a liaison for his or her congregation or faith community. Navigators will follow that patient, and they have access to the information when in the hospital and about the things that they might be sharing after hospitalization, but that person remains in their system. But the navigator people are hospital people. The liaison people are the people that represent your personal faith community, however you've organized that.
When a person in our community signs they want to connect with us as a liaison, do they automatically get the navigator services too?
So the best way to explain this, and I know we're going to move forward, but just want to touch on this. So the faith leader of the individual congregation signs a memorandum of understanding. He or she signs that, and then he or she identifies a liaison or liaison from that faith community. And that liaison will be in connection with pastoral care coordinator at Northwestern Sinai and RN health navigator at Carroll County if your congregant who has agreed to be a part of the program comes in. We will provide a navigator, a RN navigator, a health navigator, to help explain or walk you through your process, the congregant who is in the hospital, and definitely before there is a discharge meeting. The liaison, the congregant, and the faith community work in concert to provide the best care that your congregant needs who was just in the hospital or being discharged from the hospital. You're welcome.
Good questions. I'm glad we got clarification.
I'd like to get back to the transportation issue. For about 10 years, I have been providing transportation together with other people in my synagogue, Beth Israel, for people who have to go to the hospital, people who need doctor's appointments, sometimes people who can't shop for whatever reason. They be elderly, and we help them with that as well. As was mentioned earlier, we have a nurse and a social worker in our congregation on a previous program, and sometimes they will call me or the office will call me and said, we have a person who needs help. They're elderly, they've just had an operation or whatever, and they can't get to the doctor's office or whatever. So it's quite possible within our individual congregations that we could set up a system to help these people. Some of us are retired, we have more time, and some people just aren't working and can provide this kind of service. But that can be done on an individual basis, and it's worked very well for us over the years.
I have actually two questions. The people that are transporting from their congregation members to the to the doctors or to the drugstore or whatever, there was a question about the liability for that. That would also be covered under our church's individual liability insurance. Okay. The second, the other question I had is that when we go back to our congregation, there may be others that would like to be a part of this. I can just call and get sent over the confidentiality agreement forms and so forth. Okay.
Yeah, and you can always check with your individual liability insurance provider to make sure that question is taken care of. They will let you know what the policies and procedures, the format that need to be done with that. And the other thing is unique part, the gentleman just spoke about Beth Israel. When you see one health ministry in a faith community, you've seen one health ministry. These are so unique to the, I want to stress that to whatever your faith community, the members and the surrounding area that it encompasses, that is very unique to the people who are part of that. They also can be part of a resource to the general community that if you're interested in doing that, again, it follows the policies and procedures, role descriptions, and this might seem more from the healthcare side. It's also good to have those in place for the faith community so you have clear processes in place. And everyone knows from the faith community when this go, they know what resources are available so that they can contact those particular ministries or programs that are in your faith community.
Just want to add two things. One, if the person is using a walker or a wheelchair and they need assistance more than just opening the car door and letting them sit down, there are resources in our community that will help provide transportation. So each one of us, Baltimore City, Baltimore County, there are our services that will help provide that transportation. We're not asking you to take somebody who's bedridden, put them in a wheelchair, and take them to some place. So just let's clarify that. The other thing, too, if a person is complaining of chest pain, shortness of breath, and they're symptomatic, if they don't look good, common sense, do not put them in a car. So you call 911. Same thing we teach our kindergartners. So just think about those things. So that's pretty much it in a nutshell.
What I like to say and hope that none of us get discouraged as we begin to go forward setting up our ministries. And I wanted to say that all of us will probably have a unique ministry as to what we do. And hopefully all the things that we're hearing won't scare us. Whatever you're already presently doing with your congregants, keep doing it. But then learn from somebody else as to what they're doing. And hopefully from the sessions that we'll come to, the different webinars, et cetera, that will be offered to us, that we'll keep some understanding and gain some understanding of how you're doing it and how we can perhaps partner. And talking to Stephanie and also Suzanne and also Vinny and others from Maryland Healthcare, we've been talking about how we can make this be even more effective. And one of the ways is for us to get a list of who's here today if you agree to have us communicate with one another. And so we can share our best practices that we might be able to, come together and add on. It's my intent of what I understand, even at my church and my congregation, is not to try to reinvent the wheel or even do some of the things that you're currently doing. If I can do it, I will do it. If I can't, I won't. But I might partner with one of you. So my hope is that no one leaves here and get discouraged and say, we can't do this. Because I can is not in the Word. The Word says I can do all things through Christ who strengthens me. So prayerfully we'll go forth and have that attitude when we go forth.
Good spot. In the interest of time and God's precipitation, if you could wrap up, go to the bathroom, and we're going to move back into the other room for the next portion of the program. Okay? Thanks.